Well, good evening. We would like to welcome you tonight to our webcast, our video webcast, providing education for the cancer patient in our community. And we are very excited today to have a very special guest with us that we're going to address palliative care treatment. And we are honored to have Dr. Kelly Erola with us. Did I do okay?
Yes, you did. Just
And
call me Kelly, please.
okay, I'll call you Kelly, but we are thrilled to have you here with us this evening, and to really, I think, palliative care is a terminology that most people are not familiar with, and right now in the Wilmington area, our palliative care is in several places, and I think, but one of them is at you hear Lower Cape Fear Hospice, and people tend to, uh, you know, turn the mute button on. And so, what we want to do is to say it is a very powerful knowledge and tool to have, even when you become first diagnosed with cancer, to have that service right by your side for you and your family. And I know for myself, I was saying, okay, really, what is palliative care? And learning for me, just through definition, is relieving pain without curing the illness. But you bring such a different uh, treatment and service to that of what palliative care really is and the different ways that it can be introduced to the patient. Do you mind addressing that for us right now?
Not at all. I'm very passionate about palliative care, as you'll learn. Palliative care is an extra layer of support, and it's a medical treatment for people with serious illness. So yes, cancer treatment, but not just cancer, heart disease, lung disease, ALS. There's many other serious dementia, Alzheimer's dementia. So there's many serious diseases out there in addition to cancer. And when people are diagnosed, it's scary.
Yeah.
It's scary. And trying to understand what is going on, what's going to happen. There's many questions and questions that they don't even think about, let alone going through treatment, for instance, in cancer. So a patient is diagnosed and then they have to, are we doing radiation? Are we doing chemo? All these treatment options, and it's very confusing and overwhelming. And that's why both the American Cancer Society and ASCO, which is another organization, really support palliative care being available to patients with cancer from the time of diagnosis. So palliative care is another layer of support that works with the team. So the patient has their oncologist, they might have a radiation oncologist, they have their whole team focusing on their treatment and how we're going to tackle this disease. But what about how the person is feeling? How are you feeling today? Are you having pain? How is your breathing? Do you feel short of breath? Are you anxious? Stressed? What about finances? What about your kids? How do you talk to them?
Right.
Friends. Friends are there and they want to support, but sometimes they just don't know what to say or what to do, and sometimes they stay away, as you know from experience. And how do you communicate? So palliative care is that extra layer of support that's there alongside with the regular team to help the patient manage any physical symptoms, any stress from the disease, understanding the disease.
Well, I think, and I think as we were talking earlier, we found out that we really are much about the same. That at the time that we find out about the referral, whether it be from an oncologist, their primary care doctor, word of mouth, and you're going to tell us how to get in touch with palliative care, is that we're there as an additional support system, to see them all the way through their journey. But what I was impressed with as I learned more about your palliative care treatment is that so many people think, well, they're leaving their doctor, they're leaving their treatment. So can you talk to us a little bit about how you work with their existing treatment medical management that they're currently under?
You know, one model I can give you is we're there to work with the team. So, for instance, if you have a cancer patient who's going through treatment and their diabetes gets out of control for some reason, they go see their doctor about their diabetes and management. Or if they're having lung issues, they may get sent to see a lung specialist, a pulmonologist, or a cardiologist. So if they're having pain and symptoms and things, palliative medicine is another medical specialty that's there to help assist them, that works along with their physician and along with their team. We still have a big educational gap in the medical community in really understanding palliative care.
True.
And I think that, you know, that's a real hurdle. When some people hear the word palliative care, oh, they assume that's hospice. And palliative care
Yes.
is not hospice.
No.
Hospice is palliative care in the last 6 months of life. But to qualify for hospice care, your prognosis should be less than 6 months. That's not palliative care. Palliative care is for patients who are actively going through treatment. They're going through curative treatment. It's to help with those, the pain, symptoms, those other aspects of the disease, to look after the whole person and to help the family as well. And in palliative care, we have patients who we follow and who, you know, get through their chemo and cancer, and then they're stabilized, and they may not need palliative care, or they may down the line, you know, have some symptoms that develop and need it again. So we're there working along with their team, and of course their own physician is still driving the train.
Well, and that's what we really want the medical field to know that and understand that too, and the patient to know this is just one more asset, you know, one more benefit we have to help us through this time. And with their caregiver, I think you're a huge benefit to the family and the friends, and that's what we want to be able to do, because when a serious illness, and such as cancer that we're relating to today, it doesn't affect just the patient. It affects everything in their world. So what we want to be able to do is to provide any benefit of support, you know, which palliative care is, that's what it is. It's support. And so we certainly want to be able to do that. So tell us a little bit more. You referenced too about teamwork. I know that you have nurse practitioners that are in the area that the patient is being treated or resides, and there's a team that's involved in that. So how does that kind of work?
Well, we have a few different teams. So Lower Cape Fear Hospice started the palliative care program a number of years ago, understanding that there was this gap. Patients who have serious illness who didn't qualify for hospice, they weren't in the last 6 months, but still had symptoms and pain and needed help. And they started the palliative care program. The palliative care program originally was inpatient. So at New Hanover Regional Medical Center and now at Novant Hospital, we have an inpatient palliative care team. Doctors who are specialized in hospice and palliative medicine. There's a specialty for hospice and palliative medicine, like there's a specialty for cardiology, and there's a board certification. So our physicians are board certified in the field. Our nurse practitioners have certification and experience in hospice and palliative medicine. On the inpatient team, we have a social worker. So the physician, nurse practitioner, social worker, another nurse for support, and then chaplain services for spiritual support as well is available.
That's wonderful.
And that's our inpatient team. We also have what we call a community or home palliative care team. And in this team, we have nurse practitioners who are assigned to different counties in our area and see patients in that geographic area who a palliative care referral comes in, and the nurse practitioner will see that patient. We have an RN to support the program and some other administrative people. We have physician involvement as well. We really would like to add a social worker to our team as well, because it truly takes a team to help manage a patient. And palliative care is all about interdisciplinary team working with the patient and family to meet their needs and really be that extra layer of support.
Tremendous. And I think it's worth pointing out that in many other states, palliative care and many times is a separate location as a clinic.
Correct.
And so it just happens to be that currently right now in our area, we have inpatient at the hospitals, and then we have where the management is home is
Right.
at Lower Cape Fear Hospice. But it is totally separate than your life care center
Yes.
and your end of life center.
Correct. Totally separate from,
Yes.
in hospice program, we have our hospice program is home-based, and there's a team for hospice, and then we have the inpatient care center. Palliative care, it's a totally separate program, totally separate staff. So palliative care is a nurse practitioner visiting. We really would like to have an outpatient clinic setting, so a clinic where patients can come,
They're a little more
set up an
comfortable with that.
appointment, right, come and meet the team, in an office-like setting where they come. Not everybody wants to be seen in their home, and that's understandable. So, and some people really want to get out, and so it'd be wonderful to have a clinic setting. So that's something that we're looking forward to working on in 2018.
I think that's a great initiative. How does a patient know that palliative care is right for them?
That's a very good question. And if it's very basic, really. If a patient has a serious illness, they could benefit from palliative care because it helps with symptom management, it helps with stress and understanding what's going on with disease. So any serious illness, then they really need to think about palliative care.
And, I know working with our patient advocates through Hope Abounds, we strongly feel that it is a tremendous advantage at the time that they even contact us, that we feel very comfortable to refer to call palliative care as an additional support system, for them.
Studies have shown that patients who have palliative care involved actually do much better. They have less depression, lower stress levels, and actually live longer and get through treatment better. So they have a better prognosis when palliative care is along supporting them. And there are clinical trials out there and studies that show that.
And I think it's very important, and I'd love for you to expound upon the fact that patients do not have to give up their doctors and the medical management that they're under. And how does the nurse practitioner and the team work along with the doctor?
It's, when people think not only the community and the public and patients, but physicians think too, well, if we have palliative care, then that means palliative care is there. Patients undergo full treatment, active treatment, they're doing everything. But if a patient, for instance, is having pain, and sometimes a physician is very busy, particularly in oncology, where, doing the chemotherapy and figuring these things out, that the patient's pain or the patient is afraid to talk about pain. Sometimes they're afraid to say, I'm in pain, because if they think they're in pain, well, that means they're either not being tough enough, or that means the disease is worse. They don't want to tell the oncologist they're having pain. He might, think they have different ideas. And we try and say, we know, for instance, in pain, if we manage pain well, people do better. They function better. They get through treatment.
You heal better.
Exactly. They do much better with pain management. Palliative care physicians and nurse practitioners are trained in pain management. So they are pain management experts, and understand dosing of pain management and understand side effects and how to manage them. So, the patient's physician may be busy, managing other patient issues, whereas a palliative care team say, okay, we can help manage your pain, we can help manage your shortness of breath, we can help manage your anxiety, and start dealing with those issues that affect a patient, day to day. How are you sleeping at night?
Right.
Now tell me, are you really sleeping? Do you have trouble falling asleep? Do you wake up during the night? Are you tossing and turning?
Because rest is so important.
And we're not saying that, I'm not saying that medicine is always the answer. There are other non-pharmacological, non-medicine ways to manage problems. That's where the team comes in and assists. And trying to really encourage people to talk about what's going on. What is the elephant in the room? And we also, when you're talking with patients and families, we find that the family says, well, blah, 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 and the patient says blah, 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 and they really need to communicate together because they
That's
really
a
are saying
huge
this,
gap.
they're saying the
Mm-hmm.
same thing, but they're afraid to talk to each other.
Right.
So trying to help negotiate some of those conversations and to talk about, what's going on. And sometimes the family is afraid to, well, we really don't want to talk about the illness or anything, let's just ignore it. Well, that's not always what the patient wants.
Right.
We need to talk about it. We need to talk about how things are going and where I'm at. So facilitating those conversations, communication, I think, is probably one of the essential skills that a palliative medicine provider needs to have. It's one of our basic tools. Yes, I talked about pain management and other symptoms, but communication skills are absolutely essential as well. We know in the healthcare system right now, there's still very much fragmentation.
Yes.
The lung doctor tells the patient one thing, the heart doctor says one thing, this doctor says one thing, and sometimes the patient feels, do they ever talk to each other?
Mm-hmm. Mm-hmm.
And so trying to coordinate these different conversations to say, okay, what's the common theme, what's going on, so the patient can understand all these conversations, get all these people to communicate, to get a whole picture
Mm-hmm.
of what's going on. And that's so important. That's where palliative care assists as well.
And that's where the networking, even, within the community, because many times as from an advocate side, we're saying, well, have you talked to your doctor about this? Yes, but I don't feel like they're talking about my case, or they don't understand what happened at my last appointment. So many times what we do is that we provide a notebook to a patient, because when our daughter was diagnosed, and her father and I learned of this, the only thing I knew to do was within me is organization. And I thought, we have to have a plan. We have to have some organization. So as a parent, I put a notebook together and said, okay, this helps me. If it doesn't help Kelly, it helps me to
Right.
know what was the last appointment, what date, what are our questions. We kept everything organized, had our pathology report in there. We had to advocate on our own to keep the medical field, because you are seeing so many different
Right.
doctors during your medical management and knowing what to take place. And then you were talking about medications. Just to tell a brief story of our own. When Kelly was petrified of getting addicted
Uh,
to pain medications. And that was the biggest hurdle that her father and I had in helping her. She could endure and had a very high tolerance for pain. But that pain can traumatize the body so much that it can really affect the healing process, certainly mentally, and you're not resting, which the body needs. And so if you take the dosage
right.
as the doctor prescribed, you don't have to worry about addiction.
Right.
So when that was very hard for her, but when she had to have her second surgery for very bad radiation burns that she received, we went to Georgetown, and Kelly definitely took the medications as they were provided, and what a difference it made, and how quickly she was back on her feet and resting.
This is a significant problem right now. We all hear about the opioid epidemic and things, and so people think that, oh well, I'm just going to contribute to the problem. If I go on any pain medicine, I'm bad, and that's the way it's been treated. But there are legitimate reasons for pain medicine and to take pain medicine, and to use it appropriately. So we have to advocate, as you did, for appropriate use of pain medicine, and ensure it's managed properly, because for patients that need it, it truly does benefit overall their quality of life.
Yeah. Well, and I think that is a huge thing, because many patients are afraid, and they hear of the opioid.
Right.
And they're afraid of, can my body withstand that, and can I afford it? but it is as important as the rest of their treatment that they are going through, which I think is important. Um, and I think we did address who else besides the patient benefits. So I think that same information is even very proactive for the caregiver
Yes.
to be aware of that. And they're not withholding medications that the patient needs, and with all good intentions, for them, but to know that it is part of their treatment.
Well, when patients are going through, treatment or are stressed, it's hard sometimes to remember, which pills when. So having the family or a reliable person involved to help manage medication, is important. And so, right, educating the caregiver, and when you're looking at side effects of treatment, educating the caregiver about how to manage. And what you said before, similarities in the work you do is that understanding community resources and trying to know what's in your community and trying to help patients' families make contact with resources that they might need to really help manage the situation better.
Absolutely. And I think, and you hit key, communication is so vital, and knowledge. And between those two things, the empowerment that it gives a patient to, if they feel like they're being communicated with, they're being understood, and they have a team and a support team that is working for their best interest and their behalf. And then also it takes away the fear. Fear will stifle you, as it many times has kept them from contacting the palliative care because they misunderstand what it truly, and the definition it truly is, and the benefit that it could be through their treatment. And so we're glad to have you. We're glad to refer you to every patient.
That's why I say it's very interesting to me, because when somebody's afraid, you afraid to go to see your cardiologist?
Right.
You shouldn't be afraid to go see your palliative medicine physician or nurse practitioner or provider.
Right. Yeah, so it's no different.
Exactly.
So how does palliative care help someone choose a best treatment option?
What Palliative Care does, what the team does, is they try to help you understand, what do you know about your disease? What do you want to know about your disease? And then try and help collect information if you don't have it. So to find out, from the oncologist, what exactly is it? The patient, didn't understand this. Maybe we can help explain it to understand what's going on. So collecting information for the patient to help. So what we want to do, we talk about an informed decision.
Correct.
In order to be informed decision, you have to understand what's going on. And as we know, people have different levels of understanding. And sometimes we physicians use jargon, or we're talking and we think, I said, non-pharmacological. What does that mean? That means non-medicine. But, not everybody knows. So we have to really try and make sure we explain things in simple terms, not simple, stupid, I don't mean that, but terms that people can understand, because medicine can be a different language, and you get into some of the technical photography and taping stuff, and I have no idea on that lingo. So the same thing with medicine. So trying to really make sure that the patient, the family understands what they've been told, what their different options are, what are the expectations, so that they can understand where they are in their disease and how things are working. So for instance, I'll give you an example. So a patient undergoes radiation treatment. Well, many people think when they go for that radiation treatment, it's just zapping and killing, everything's going to be gone. Well, it doesn't quite work that way. It kind of shrinks things and stuff, but they have to understand it's not like it blasts out overnight and it's gone. But just to explain, so they understand what's happening.
True. And I know that we talked a little bit before, but I want to make sure that we did touch on the fact that this is in-home care we're talking about. Right.
So we have, as I said, we have the inpatient program if you happen to be in the hospital, but if you're not, then we have our home-based program. where the nurse practitioner will, and we have basically a nurse practitioner with physician support program, comes to the patient's home to visit them in their home.
Okay, and this is in every county, North Carolina? Is that kind of broken out
Well,
regionally?
we cover the Palliative Care program here covers the same counties at Lower Cape Fear Hospice. So the Palliative Care program, being a program of Lower Cape Fear Hospice, it covers the same 5 counties that Lower Cape Fear Hospice does. So we go up to Jacksonville, Onslow, Pender counties, New Hanover, Brunswick, Columbus, Bladen. So quite an extensive area we do cover.
Okay, and are there other, I know you have other facilities,
Right.
but, and the same services provided, but that is the counties that Lower Cape Fear Hospice is in at
Correct.
this point.
Correct.
Okay, gotcha. And how does somebody get palliative care?
All they have to do is call. All they have to do is phone. Patient, family member can call our number, and somebody will answer the phone, and they will collect the information. We need a physician's order, but we can take care of that for a patient or family.
So
we
they don't have to call their doctor
They don't
first.
have to. And the other thing we always say is to ask for it. Ask for palliative care. And it's very interesting to tell patients to ask for palliative care. Well, my doctor said that's hospice. And you say, no, it's not. Your physician is not informed.
Right.
And so we're trying to educate, as I said, but asking for palliative care. So either calling the palliative care program or saying to their physician, I would benefit from palliative care. And still, sometimes the patients have to explain to the physician what palliative care is. So your program, talking about palliative care, I hope will empower people to understand what it is so that they can ask for it and explain to their physician, and if not, tell them, maybe you need to read about palliative care and the benefits.
Right, and to say, I've done the research, and I am your patient, and this is something that I want.
Right.
And it's going to be creating teamwork.
Yes.
I'm not leaving as a patient.
Oh, no.
I am in my right mind. I'm
I
not
need-
looking
I
at
need
this
some-
negatively. I just need some support
Exactly.
outside of the office of when I see
Yeah.
you.
I need some help. I need some support. I need some management of some simple symptoms like pain and constipation, and
Right.
I want these addressed.
Okay, so should people ask for you, or just by calling the number that we are showing on our screen
Yep.
for people to call, they can, a message will be provided and a social worker or nurse
What?
practitioner will call them
Correct.
and kind of do an assessment and answer any questions that they have further
Yes.
that maybe we haven't addressed.
Absolutely. Absolutely.
Okay, well, I think I just commend the service, through palliative care because it truly is a support. It's a blessing to know that you're there. You're that intermediator that they need in between their doctor and being at home and themselves, and for us too to be able to reach out to and say, you know what, this would really benefit you, and to not only for the patient, but certainly for the medical field to understand that this is a tremendous service, and the fact that no one, okay, and something we haven't addressed as I think about this right now is cost. Can we address how that is taken care of?
So it's like visiting any provider. So it's the billable service. So just the nurse practitioner visit or the physician visit. That's cost. And if so, most insurances cover it. Medicare, Medicaid, private insurance. They cover the cost of the visit like they would going to see any other physician or nurse practitioner.
Okay.
And if there's any issues in terms of no insurance coverage, then our staff are happy to help deal with that.
Okay, well, that is wonderful. Is there any last words you would like to share?
Well, we really need to get the message out about palliative care. Palliative care is a recognized medical subspecialty that is there to help patients with serious illness, to really provide symptom management, dealing with the stress of the illness, helping to understand the illness. And it's truly that extra layer of support that works with the patient's team. When I say the patient's team, the patient's physician. They might have a primary care physician, they might have an oncologist, they might have other physicians. But palliative care is there to work with their own team and, like you, to help advocate for the patient, to make sure they understand what's going on, help manage their symptoms, and focus on how are you feeling today. Not what stage is your disease and how is it growing, but how are you feeling?
Right.
You know, as I say, are you sleeping? Are you eating? Are your bowels moving? Are you having pain?
Right.
You know, anxiety, to deal with those issues. And that is truly what palliative care, and that people benefit from palliative care. And in the palliative care field, we're excited that more studies are being done that actually demonstrate the value that palliative care adds to patients and to families. Because we really, in this day and age, we're all about value-based care. And so we know that palliative care is value-based care, providing good quality care.
Yeah. Well, we also know that for Hope Abounds, now that we're 8 years old, approaching that birth date, which we're very excited about, many demographics have changed, especially in the age of the patient. So we have many young patients being diagnosed. Does the palliative care also help any with, in regards to the family, as far as children?
Yes, yes. And you know, we have this whole survivorship, you know, we've labeled it survivorship. You know, once you've gone through cancer and gone through treatment or into remission, you still, the disease is there and probably always at the back of your mind. And so sometimes there are issues in terms of post-treatment as well. You may have gone through, your chemoradiation, you may have peripheral neuropathy, which is numbness and tingling. You may need medication and symptom management. Even after the disease has gone into remission, you're left with some symptoms or some things to deal with. And palliative care can help deal with that as well. And help deal with the family and trying to work through, survivorship issues as well.
Well, and Hope Abounds works not only with adults, but we have a strong pediatric program.
That's what.
So you're as effective with the pediatric?
Yes,
Okay.
pediatric as well. There's a huge need for palliative care in pediatric with a number of congenital abnormalities in terms of diseases itself, but also dealing with children of patients who have serious illness, because as you said, it impacts the whole family. The whole family is impacted, and it depends on the developmental age of the child. So understanding the child and what age they're at and how they view things is really important in terms of supporting that child as well.
Well, that is a wonderful service, and as we're learning, it's harder and harder for our pediatrics in the community because they are having to travel to
Yes.
Chapel Hill for their treatment.
Right.
And many times they're there, and then there's a huge gap for the families that are here. And so I think to be able to have that to minister to the pediatric cancer patient as well as the adult is just key and vital support.
And I just want to say, I joined Lower Cape Fear Hospice a year ago, and I'm very thrilled to be here. I have many years of experience in hospice and hospice and palliative medicine, so I'm learning more about the community, and it's a wonderful community here, and the resources and organizations such as Hope Abound and what you do. So there's excellent support, and it's how do we get people aware of what we do, have them aware of what we do, how do we support each other in the community so we can benefit, because that's what's really important. So when I joined Lower Cape Fear Hospice as their chief medical officer, I was just really thrilled that they have supported a palliative care program and have put resources into palliative care and understand that yes, hospice is important, but you have to have a 6-month prognosis for hospice. There's many people with serious illness who don't have that prognosis and may never have that prognosis, but need that extra layer of support
Right.
at some time in their life, and that they've supported a palliative care program. And we continue to work to grow our program. And as I said, hopefully an outpatient clinic is something that we can provide for the community as well in the future.
Well, we certainly wish that for you too, and we count it an honor to be able to have you and here in the Wilmington area, and the difference that you're going to make with that program, what hospice does in our community. We just we're so proud of it because they have grown. They do a wonderful work, and it's a wonderful asset to have as you're going through any kind of serious illness for any loved one. On behalf of Hope Abounds, thank you, Dr.
Well,
Kelly.
thank you for having me. I've enjoyed
for
it.
being here, and this won't be the last time. I look forward to doing another maybe panel discussion a little bit more with more of your staff members of hospice, and have the medical community as well as the general public to have a thorough understanding of really what Lower Cape Fear Hospice and all the programs that they have to offer are a true benefit to us that we need to take advantage of when that appropriate time comes.
Right.
So God bless you.
Thank you.
And until then, thank you for joining us. And we look forward to being with you on our next program. And that will be on January the 23rd with new patient information with Heather Fairclough. So join us then. And thank you, and God bless.